You coming to bed, hon?
Yep, honey, I'll be right there. Just gotta turn out the light. Ow! 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 Ah! Gah!
Some things never change. Like your kids always leaving tiny toys on the floor for you to step on. And Geico saving folks lots of money on their car insurance.
Sweetie, I think I left the downstairs light on.
Please don't make me go.
15 minutes could save you 15% or more.
Ladies, we're here to meet you where you are. Welcome to the Dare to Ask podcast. Episode 8, Candid Fertility.
So I feel like having the struggles means that when I'm talking to you in clinic, I totally get what you're going through.
Yes. I'm Corey Jensen, your host for this Dare to Ask podcast. I'm a mom to a big family and have delivered 5 babies. And like many women, I try to stay informed about my wellness as well as the health of my kids. We've created a space to have open conversation about what's going on with the woman's body without feeling intimidated in a clinical setting. A place to talk like girlfriends do. A space that dares to ask.
We're here to make a connection, be authentic, and really get to know your provider. Yes, know the person behind the stethoscope. Dare to Ask will be where you hear the questions that we are all curious to know, but just need a space to do it. You've landed on the Dare to Ask podcast, show hosted by Corey Jensen and sponsored by Essentia Health.
I'm sure it smells fine, it looks fine, it's totally normal, and I'm going to reassure you that you're normal.
Fertility. When the fertility expert sitting across from a couple wanting children has sat in their same seat, a bond is formed. When I spoke with Dr. Pandolfo and we recorded this episode, she was full term with her second baby. And so when she speaks of the struggle through fertility, you're going to feel those raw emotions in this conversation. That vulnerability can build a kinship in a professional setting. It can also build one that's inspirational to an outsider who has never experienced it. So her perspective, it is giving her patients hope, and I'm here for it. We are also going to discuss what we are not talking about as women at alarming percentages. And we're going to get into some fertility myths, many of which are insulting. So we've got a lot of ground to cover, and optimistically, she explains how many things can be fixed or can be worked with when it comes to fertility. The experiences vary greatly. This conversation has a little something for every woman. So let's get to it.
Can I hit you with some fast fire questions?
Yeah.
It's going to feel like you're in med school again. Spa day or gym?
Spa day.
Mani or petty?
Petty.
Cook dinner or bake a cake?
Bake a cake.
Bestie shopping or solo shop?
Solo shopping.
I'm the same.
They just slow you down.
And I love my best friends, but it has to be like a special planned thing for me to do that.
And I don't care what you think about what I bought.
Right. When a friend in the other room is like, come out and show me.
No, I'm like admiring myself in here.
Either that or I already know this is never going to leave with me, so there's no way I'm even going to take it out of the dressing room.
Right.
During this episode, we were so excited to be able to just literally get behind the stethoscope and learn a little bit more about providers. You are in obstetrics, GYN, fertility. I love this bag we're about ready to unpack. You come with so much knowledge. Girl power vibes are big time right now.
More and more, I'm starting to love what I do because they're expanding kind of everybody into what they like to do more than just broad OBGYN.
I'm going to liken it this way because my husband is a teacher. He's qualified to teach 7th through 12th, but he loves to teach upperclassmen.
Exactly. Like, I love all of OBGYN, but I really love the fertility part. My job is way more fun and way more satisfying.
You didn't always have this passion for fertility when you were getting into this career?
Starting in residency, I liked it, but it wasn't something I wanted to only do. Mm-hmm. And then when we got to the 4th year of residency, my husband and I decided, let's have a baby.
Yeah.
And we couldn't. Oh my gosh, this is so hard and difficult, but fascinating and really cool. And at the time I was like, well, should I go further? Because you can specialize in just infertility. Mm-hmm. But we were kind of thinking, well, if you're going to put all this effort into making a baby, I don't want to do 3 more years of training. We're now in this kind of tough spot of like, do you want to do just broad OBGYN or continue to do what you like?
Yeah.
And Essentia let me be a generalist, but do more of the part I like without having to do the expanded training.
The fact that you're in fertility and you went through infertility, you are willing to get a little vulnerable with us. Let's start with marriage.
We got married in August of 2014. He's 6 years older than I am, which I always say was good because then he did all of the grown-up things. And so I don't cook, I don't clean. He pays the bills. He does all the adulting in our house.
Yeah, I love it.
But luckily, too, that meant that when we got to the point where we were trying to decide family, what should we do, he'd been working for a long time while I'd been in training, and we could afford to go through the infertility treatment.
Yes.
Because for a lot of people, that's the hard part, is you can't afford it.
Right. I mean, to think that you finally arrived in your heart and your mind that you're ready to take this next step, but then you look at the bank account and go, are you kidding?
Yeah. You're
This
like,
isn't
shoot.
for me. Yeah. So how quickly did you realize that you guys were struggling to have a baby? Because that one is always one of the big unknowns. Fertility expert here to share, because I feel like I've heard different answers from people. Like, how long should you try until you actually start to get concerned or go to a specialist?
I was, young at the time. I was 28, getting regular periods, no medical problems. And so
no signs.
Nothing.
That this should be an issue for you.
I was one of those totally naive people who thought, I'm going to pull out my IUD and I'm going to get pregnant and this is going to be no problem.
Right.
And we tried for a little over a year, and then finally I was like, fine, I'll go see one of my attendings. Mm-hmm. And we figured out that my ovaries didn't have as many eggs left as somebody should for my age.
Right.
They call it diminished ovarian reserve, and you're like, well, shoot, now what do I do?
Right.
So we went through the whole Clomid, IUI, all of those cycles, because that's the cheaper way to go. Mm-hmm. And for a lot of people, it works. Mm-hmm. And then after a couple of those, it just wasn't working, so we went straight to IVF. Mm-hmm. So.
What was that story like for you?
Our first cycle didn't work. Our second cycle is Lauren. Our third cycle didn't work. And then we had a spontaneous miscarriage in between there. And this is now our fifth go, and this one so far has been fine. So I feel like having the struggles means that when I'm talking to you in clinic, I totally get what you're going through.
Yes. Yes. Do you find that to be one of the advantages as the provider, to literally be able to look at your patient in their eyes and say, I know what you are going through?
Yeah, I don't think you have to have gone through something in order to be good at your job, but I feel like in my scenario, it makes me better at what I do because I can at least relate with you and I can give you a little bit of hope and I can be straight up honest and be like, hey, you have to do this because it's just not going to work. Like, if that's what you really want, this is what you have to do.
Anytime that I'm able to relate with the professional, and especially when it's my provider, I have a kinship. I have an immediate bond. That empathy goes so far. It's priceless. I love that you're able to share that with your patients. So, Lauren, she is your little one, Earthside, who is how old now?
3, acts like she's 15.
Uh-huh.
Everybody says 3 is going to be worse than 2, and I don't know if we're going to survive it.
I'm old Mother Hubbard over here. All I can say is that was the case for almost all of my kids. 3 was worse than 2. In terms of tantrums, it just felt like they were overbearing at 3. However, that personality and communication makes you fall in love with them even more at 3, too.
So every night she screams for my husband at like 1 to 3 in the morning, and he has to go get in bed with her.
Oh.
And because I'm the hard one, I'm like, go get back to bed.
Yep.
And I went in the other night, and she goes, oh, Mom. And she pets my face, smiles, and she goes, I'll wait for Dad. Oh. And you have to turn away so they don't see you laugh.
I know. Oh, I've been there so many times. Has ever that favoritism, whether it's on your side or on your husband's side, has that ever bothered you? A weak mom moment where you're like, not fair.
Yeah,
I had you. I made you. I birthed you.
I breastfed you for 2 years.
Yes.
Yeah. Well, I was the favorite until we cut her off. And then she was like, well, enough of that.
I know,
I'm
right?
going to like Dad now.
Yeah. Honey, thanks to you, Mommy's boobies will never look the same. But whatever, over there with Dad, it's fine.
Right.
That's almost carbon copy with all of my kids. We go through those, mommy's favorite, daddy's favorite, and you just learn to roll with it and on with the show. Like you'll get another cycle here one of these days.
Sometimes we find ourselves competing. I'm like, Lauren, do you want an Oreo? And Chris is like, you can't do that.
Let's go back to your fertility. I want to ask about the spontaneous miscarriage that you had in there. Is that pretty common going through infertility? Yours wasn't an IVF. Mm-mm. You captured one of your few eggs.
Mm-hmm. And then made it to about 8 weeks, and then we lost that one. Mm-hmm. I think not specifically that you're more prone to having a miscarriage, but it really depends on like what your diagnosis was. So for me, the quality of my eggs is probably terrible. When we've done our IVF cycles, we get one normal egg.
Oh, wow.
And so that kind of explains why we had more miscarriages. Yeah. But one of my favorite things is when you have these infertility patients who come in and they're like, I can't get pregnant. And you're like, well, sorry, honey, but you are. You know, so
that's one of the best pieces of news you could ever deliver.
Just because you had to get help one time doesn't mean you have to get help every time.
Yeah.
But it's not going to make you more prone to a miscarriage unless, you know, like if you're 45, then yes, you are. If you're 26, not so much.
Right. So now, what is the next step for you? Now with your baby boy here, family planning after this, since you have really been through so much, the stress, the emotion, the ups and downs, all of it.
We feel like 2 kids, I'm 35, he's 41, we're done. Mm-hmm. We've done this 5 times now, given it a good effort.
Yeah, great effort.
2 is enough for us.
Yeah. As a couple, you want to just arrive at what's best for our family. What do we feel led to do? And the craziest part is your mind can change. My husband and I can attest to that. Minds change sometimes and you go back for more. So I'm just so happy that you do have this wonderful perspective where you are giving your patients hope. That makes me just very pleased.
I like that I can do that. I feel like it makes them not give up.
If someone is listening right now and they are going through the thick of infertility and they have not had a successful pregnancy and they don't have a baby in their arms right now, what do you offer those patients?
It depends on why we're in the situation we're in.
Yeah.
But a lot of times it's just letting them know they're not alone. Especially as women put jobs in school and everything ahead of having families.
Yeah.
We're seeing so much more of this. You probably have no idea that half the people on the street are having trouble making a family.
Yeah.
And so really, you're not alone.
Mm-hmm. If we're talking miscarriages, I mean,
so high.
To do the 1 in 4, to think about that 1 in every 4 pregnancies is not viable, is a miscarriage.
Well, we should talk about it.
We should. I so agree.
If you don't, it's just everybody's sitting at home feeling like they're the only person. But I always say, you know, half of our clinic has had a miscarriage. Mm-hmm. We just don't talk about it.
Mm-hmm. There's small, teeny tiny steps being made where that taboo is starting to fall away a little bit more and more. But having been through miscarriage and infant loss with a stillborn, I feel like a loss is a loss is a loss. So for the mom who wasn't letting anybody know she was expecting yet, and then to go through a loss, it feels like you're just even that much more isolated. Well, wait a second. Was it even real if I never told anyone? Right. But yes, I mean, we all know, yes, it was.
Yeah.
Grief is a crazy thing. It's so fluid, too. It's ever changing. One loss maybe felt greater to you than another, and then other times you're just completely emotional because you didn't feel like you grieved enough for one loss versus another.
Or you connected with one more than the... Yeah, it's weird. It's the same thing. Like, I honestly haven't told very many of my friends that we're having a baby yet. I mean, the pandemic plays into it because you don't see anybody.
Absolutely.
But, you know, until you actually have a baby in your arms, it doesn't always feel real.
Yeah. Are you scared?
I'm not an anxious person, but as far as like delivery, yeah, until he's out and like we're holding him, I'm going to be a little nervous that something weird is going to happen.
I feel like you would be inhuman if you weren't, right? I'm so happy that you're willing to come on here and share not only your personal story, but also professional stuff too. Can I throw a couple myths? Because I feel like of any topic, fertility is shrouded in myth.
Yes.
And we need some debunking. So many people just turn straight to Dr. Google. But the myth when you're going through fertility, it's almost head shaking that people actually say, well, you should try harder.
It's about as insulting as, well, just don't be so stressed.
That's the other one, right? Yes. Relax. When in the history of time has relax ever worked for anybody in
Thanks
any
a lot.
situation? Yes.
I think stress plays into a lot of things because our menstrual cycle is so dependent on how our brain is functioning. Are we exhausted? Are we chronically ill? Are we eating and exercising right? And so there's a little bit of like a stress component. But if you're stressed, you can't just blame that as the only reason why you're not getting pregnant.
Right. Much like trying harder.
Right. I mean, you've already made it a job.
Yeah,
People who are going through infertility, they're like, no, I don't want to have sex again. Like, I had sex the other day.
You boil down everything from how much sleep to what is your body temperature every single morning to, the things that you're checking on your body on a daily basis too would make a lot of people blush. Talk about a full-time job. Fertility after first child. When people start going through infertility after they've had a first child, what kind of debunking can we do there?
Things can change with your physical health at any time. I think that's the most frustrating. People are like, well, I had no trouble last time. Well, what's different now? Like, do you weigh 30 more pounds? Are you getting a regular period? Has your thyroid stopped working? There's so many little things that we can figure out and see, like, it doesn't have to just be the expensive stuff to fix it. Some of it's super basic.
I have a friend who had a number of miscarriages. It was either low iron or potassium level was ultimately a very easy fix. But all the heartache until finding that answer. It was an answer for one successful pregnancy. Does it mean you're going to be infertile for the rest of your life?
No, not always. We can fix a lot of things. I mean, we can't fix age. We can't fix diminished ovarian reserve, but we can work with it.
You're always giving hope. I love that. Here's another one. When you have somebody who is well-meaning, trying to offer advice to you when they have no experience, and it can really hurt. Well, I had a friend who tried for 5 years and then blank happened, or this happened. You just need to try that. Women are often beat down with unsolicited advice.
Yeah, half the time you're just angry. Half the time I think it's the same as the miscarriage story. There's a lot of people who don't talk about the help they got.
Yes.
And so there's probably another version that you're not hearing, and it's not entirely helpful to get all of that advice. Somebody who accidentally had a baby at 45 might have been trying, and they might have had donor eggs.
Yeah.
There's a lot of different scenarios. You try and take it with a grain of salt, but that's not always helpful.
I just feel like now, if we can just pause before we speak, especially if you already know that they have been struggling. Let's say it's fertility. Let's say it's multiple miscarriages or getting pregnant after infant loss. When you're dealing with grief, when you're dealing with health issues, they're not necessarily looking for advice.
Right.
It's oftentimes, I just want you to be here.
On a shoulder.
Your presence, I'm here for you. It goes so far.
Further than advice sometimes.
In my mind, it totally does. The other thing that I feel more women should do is seek support groups. Because there are actually, I was mind blown at how many support groups actually are out there. And again, it goes back to, this is an issue women aren't talking vocally or publicly about enough. And maybe you're not that person. Maybe you've chosen, I'm not ready to share with the world that I'm either experiencing this or I am pregnant, whatever it is. Find a group that has gone through the same sort of stuff and reach out. For me personally, that is a saving grace.
Knowing somebody else has been there and not putting it all on yourself. Yeah. There are a few groups in Fargo. You can find them on Facebook for like infertility support, but we could be doing a lot better. And half the time, women think it's only them, but 30% of the time, it's a male factor.
And let's talk about, is it just a women's issue?
No. And half the time, men are like, well, it's not me, it's you.
Yeah.
Or women will come in and say, well, he doesn't need to do a semen analysis because it's me. But you don't know that.
Right. If we're going to do the workup, let's do the whole workup.
Right. let's cross everything off and figure out what exactly are we dealing with. I don't want to waste 5 cycles of a medication on you to realize that your husband's sperm sucks.
But really,
Yeah. Or
not only is that expensive, and the heartache, the stress, and the emotion that you're adding on to it.
every month you get a period and you're just devastated.
Yep.
You know, get to why is this an issue?
Friends that have started to struggle, they say, I'm trying. They've tried for maybe a couple months, already throwing their hands up in the air. It's not working. Clearly, there's a problem. What do you say to that person?
It depends on their age and kind of menstrual history. Because if you're not getting regular periods, I'm starting to get a little concerned. And yeah, at 6 months, I will look into why is this going on. But if you're getting regular periods and you've only been trying for 3 to 4 months, statistically speaking, you're going to get pregnant within 8 months. So we tell people try for 12 because that's the normal trying timeline.
Yep.
But I also find in this part sad or fascinating how little women understand about their menstrual cycle.
Yeah.
Like sometimes I just have to explain to you what day to have intercourse and all of a sudden the next month you're pregnant. You know, if we could just make a little calendar and tell everybody what day to have intercourse,
I know.
we might have lots of babies.
I know. I will say that I am 100% guilty of that. My 2 oldest kids was simply stopping birth control. We had 2 successful, wonderful children. And then following that, family planning was that we would do an IUD because we weren't interested in having more than 2 kids. And then I ended up getting pregnant with an IUD fully in place. And so that in and of itself, an anomaly. And that pregnancy was a loss, and I had a miscarriage. It wasn't until that point that completely changed the trajectory of my life and my husband's life, and us really having a reevaluation of our entire family plan and deciding, no, we actually do want more kids. After that loss, that was the time when I'm like, okay, how do you do this? It worked so easy those first times.
And like, what's going on?
What's going on? What's an ovulation date? And to think, I mean, I was a grown ass woman then, right? I should have known this stuff. I found an app for my phone to help me figure out when my ovulation date was.
And the other thing about those apps that I love is it actually proves to you that you're getting a regular period.
Yes.
People will come in and they're like, oh, my periods are irregular. I get one on the first day of every month. And then sometimes I get it on the 30th. And I'm like, well, that's still 28 days apart. That's regular.
Yep. There's always a disconnect between what you have in your head versus what reality actually is.
Yes.
Hence, logging anything or journaling anything. Then you have proof.
And it helps when you come into the clinic too, and I can look at your app and see, oh, this is actually irregular versus not irregular.
Wellness nuggets. We talk about that. Is there something that you wish all women knew or would practice or do every day?
Be a little more selfish with our time. Taking care of ourselves is really important. You know, obesity and diet and exercise and all of that plays into so many issues, not just fertility, but just gynecology in general.
Yeah.
And if you just put a little more emphasis on not parenting for 30 minutes while your husband does that and you took care of yourself, you might notice significant improvements in your own well-being.
What if that sounds super intimidating?
I haven't exercised in months, and I eat like ridiculous amounts of donuts. So I'm a bad... We all have a smartphone now. It's always in your pocket. Look at how many steps you got one day, and then the next day, try and get more. It's easy little stuff. Chasing your toddler counts as exercise.
I will fight whoever says it doesn't.
Right.
Okay, is there anything else that you would love to leave us with today?
A lot of times I find that people are scared to ask whatever question it is burning in the back of their brain. I can almost guarantee that I've heard it 100 times. So just ask it, because I can fix whatever's going on.
Yes. You know what? There's something so scary about that vagina that nobody ever wants to fully talk about. You're with your provider. If there's anybody you can talk to, it's your doctor.
Ask us. We've seen it. We've heard it. Like, You're not the only person. I'm sure it smells fine. It looks fine. It's totally normal. And I'm going to reassure you that you're normal.
Praise you for saying that. I do bring up Dr. Google quite regularly on this podcast. What's your feelings on turning to the internet when you have any kind of symptom instead of picking up the phone and making an appointment with your doctor?
I think if you can pick the right website or you're able to kind of weed through what you're reading, it can be helpful. Where I find the most trouble is when you find all these forums of people, don't do this, I had this side effect, I had this side effect.
Yeah.
And I try and remind people that the only people who are posting on all those forums are the people who had a fabulous experience or a horrible experience. The rest of us are too busy living a good life to get on the internet and write about that IUD that gave us some spotting and whatever.
Yeah. Eyes a little wider open and a little more common sense, maybe.
Yes.
And if there is a problem, let's just make an appointment.
Right. 15 minutes, we might be able to fix that.
In clinic, you guys are seeing patients.
Yeah. You don't want to let things go because the longer we let a pap smear lapse or your postmenopausal bleeding, or it might be harder to fix it. That's actually where our fertility program has blossomed, was with the telehealth. You could live in Jamestown or Carrington and we can help you make a baby because telehealth.
In that time, just a brief conversation, you can find out if the next step we actually have to physically see you.
Right.
You know, I need to have hands-on so that I know, you know, what's our next step. Or you might be able to easily solve that problem. Make a baby.
Well, and so many things are timed. You know, if I do a virtual visit and I have to do labs on the 3rd day of your cycle, that way we can maximize that time that you have to drive to Fargo. Plan it.
Thank you. I think this has been such an enlightening experience, and I'm so happy that you came in here and shared with us. And I hope to have you back.
Thank you.
Dr. Pandolfo, she basically, this is one of those times where I want to say she made me laugh, she made me cry. She's a wealth of knowledge when it comes to fertility and such a warm person as well. A peek ahead to the next episode on the Dare to Ask podcast. My guest is a queen in the region. Well, not literally, but in my eyes as well as many others. We lift her up because of her work in a very male-dominated field of orthopedic surgery. So we're going to talk to Dr. Roxanne Keene and get a fresh take on what it's like being one of the only women in the state doing what she does. It's coming up on the next Dare to Ask podcast.
The information contained in this podcast is not intended to be a substitute for personalized professional medical advice, diagnosis, or treatment. The information is general in nature. If you have questions or concerns, please contact your provider.
Socks are the #1 most requested item in homeless shelters. Underwear is the second, shirts are third. At Bombas, socks were first, made with comfortable details for everyday wearing. Then underwear and shirts too, all designed to perfectly fit. At Bombas, every item you purchase means you're donating an essential clothing item to someone in need. One comfortable clothing item for you, one donated to someone in need. Bombas, comfort for all. Get 20% off your purchase at bombas.com/comfy. /comfy.